Social workers are an integral part of our care management platform. They help assist with the navigation of patients across our system, discharge planning, really focusing in on those psychosocial needs for our patients and really looking at it from the patient point of view.
Bentab is a level 1 trauma center. And every time when one of these patients comes there with the life-altering traumas, most of the time we don't even know who they are. So identifying them, locating their family, help them through the care continuum, and even transitioning them to a rehab facility and eventually home takes a lot of case management, intervention, collaboration, and coordination.
The initial client assessment is pretty much where you're gathering information, and ultimately we're trying to just gain some clarity on their environmental as well as psychosocial factors that can help us to link them with whatever resources might be helpful.
With facilitators, we can tell you where to go to apply for SSI. We can tell you where to go to find that specialty. We can tell you which hospitals to go to get what you need. Think about social work, the profession, like Medicare. It's a huge umbrella. Under that umbrella, there are many different compartments that make up social work.
We have several clinics across the city, and most of our clinics house a social worker or a nurse case manager. Patients come into the clinic, sometimes they request to see a social worker for different reasons. So social workers play a major role in assisting those patients in the clinics.
Patients could travel long distances to go to certain hospitals depending on where they want to go. But when they're here within the community, they're most likely coming here because they live in the area. So it's important to know the things within your area, all the different resources, and really get connected. Advocate for your patients when they need it. You know, a lot of times patients don't know what to ask for. So it's asking the right questions to find out what it is that they do need, and you being there to step up until they're able to stand up on their own.
If you give a man a fish, he'll eat for a day. If you teach a man how to fish, he'll eat for a lifetime. That's what empowerment is to us. It's sort of teaching our clients how to fish, how to be able to empower themselves to rebuild their lives.
Communicating appropriately is very important. It's what comes out of us is what the patients are going to listen. Patients listen from multiple people, but when a social worker goes in, they may open up and say more things that they have not talked to anybody else.
We're not about having our own ideas that we think are best for the patient and imposing them on them. We truly assist patients and our clients in finding out what they feel is best for them and making it happen in the safest form possible.
Case management is, in the hospital setting anyway, is really discharge planning, thinking about what the patient need, how we can get them home safely and healthier than when they came into the hospital. I think it's our job to treat them as such and just make sure that they feel respected, and that we don't come with biases of what we think they should be, but just get them healthier, and educate them and reach them where they are.
So when we brought social workers on board, due to the changing needs of our patients, we saw that there were gaps in care that we needed to address.
If the doctors in the hospital feels like the patient needs hospice and the patient is unfunded or has the gold card or FAB, then they will then send that referral to us, and then we then process it on our end to ensure that that patient gets a vendor who can take care of them, whether at home or in a inpatient setting.
The work is different. It's more intense in the mind than the emotion, so it's more of paperwork and making sure everything's processed correctly and advocating at a different level.
The ultimate joy of social work is allowing my patients to allow their light to shine, and that's a great joy for me.